Welcome to our webinar on reflux, also known as gastroesophageal reflux disease, or GORD for short. This webinar is going to look at diet and lifestyle advice that may help you with your symptoms. And I'm joined today by Olivia Radcliffe, who's a community gastroenterology dietitian working for Somerset NHS Foundation Trust, and Dr. Emma Greig, who's a consultant gastroenterologist. And I'm Marianne Williams. I'm a dietetic advanced clinical practitioner working for Somerset NHS Foundation Trust. So what exactly is a webinar? Well, a webinar is a video that's going to give you advice on how you can help your reflux symptoms, and we advise you to re-watch this webinar several times to consolidate your knowledge. And you don't have to watch it all in one go. You can pause the webinar and complete it in sections if you find that easier. Before we start, I think it's important to look at who this webinar is not suitable for. It's not suitable for those who are underweight or have a history of anxiety associated with food, so for instance eating disorders, and those suffering with acute or chronic health conditions. If any of these apply to you, then please seek specialist dietetic and medical advice before undertaking any of the dietary changes discussed in this webinar. It's important that watching this webinar does not delay you in seeking urgent help. So the symptoms to look out for are difficulty in swallowing, unintended weight loss, persistent vomiting, chest pain that's not associated with food but is associated with exercise. All of those require you to seek medical advice.
We're always concerned if you give us a history of passing black tarry poo or vomiting blood, as we know these can be a medical emergency and they can be suggestive of gastrointestinal bleeding. If there's a significant amount, you should attend the accident and emergency urgently. However, it's important to consider what you've been eating or drinking over the 2 or 3 days beforehand, as we know Guinness can cause a black stool, as can beetroot, and always think about whether you've been taking iron tablets because they can dye poo black, although it usually tends to be chalky rather than tarry.
So what will this webinar teach you? It'll teach you what reflux is, it'll teach you the symptoms associated with reflux, and teach you about the risk factors for reflux, both the dietary and non-dietary risk factors, and look at some of the dietary treatments that can be used for reflux, as well as some of the lifestyle treatments. This webinar will not look at medication and surgery options for reflux, and these subjects will be discussed in future webinars.
So gastroesophageal reflux disease is actually one of the most common digestive disorders worldwide, affecting just over 1 billion, or about 14% of the world's population. And it can affect up to 25% of adults in the UK. The incidence of reflux has actually doubled in the last 20 years. Now, we're still not entirely sure why this is happening. It's been postulated that it might be due to the kind of changes in diet, the increase of the Western diet that we've seen, but we still aren't really sure.
So what is reflux, and what is it actually caused by? Here is an image of the anatomy of the body with the stomach highlighted. The esophagus leads into the stomach where the stomach acid is kept. The stomach acid is really important as it helps you break down your food so that you can digest it and get all the nutritional value from that food. The mixture of food and acid then empties into the intestines where the food continues to digest and the stomach acid is neutralized. The cells lining the stomach are perfectly able to cope with the acid, but if the acid flushes up into the esophagus for an extended period of time, thereby exposing the cells that line the esophagus to acid on a regular basis, then this can cause the symptoms of reflux.
So the symptoms of heartburn or reflux are a burning feeling in the chest, which can sometimes be felt as a non-burning chest pain, but tends to be associated with food. Water breath is a symptom where the fluid flushes up so high that the patient feels it as a flush of fluid in their mouth. If acid is rising that high, it can also cause a hoarse voice by damaging associated tissues, a cough, a sore throat, and globus, which is a constant feeling of a lump in the throat, whether you're eating or not.
And Emma, I understand that non-burning chest pain can also be a symptom of reflux. How does the chest pain associated with reflux differ from the chest pain associated with a heart attack?
So there are certain features associated with chest pain, which is cardiac, which can be more of a feeling of sweating, feeling unwell, feeling short of breath, feeling the pain radiating up into the jaw or down into the arm. Often cardiac pains are associated with movement, whereas the chest pain associated with reflux tends to be straight after meals. So that's often a good way of distinguishing. But if you've got any concerns, you should see your GP.
Emma, there seems to be a lot of confusion around the terminology surrounding reflux. Words like dyspepsia, heartburn, indigestion. Do you think you could clarify some of these words for us?
So we've covered what reflux is. Heartburn is the name for the burning sensation that patients feel. Dyspepsia is a slightly different condition and is more associated with pain right at the top of the belly in the middle, just underneath the rib cage. Dyspepsia is in two real different types. The first of those is a postprandial, very full feeling, which is meal related. So that feeling when you've really just eaten too much and can't get comfortable. And the other is more of a pain syndrome with pain and burning in that area. There's no doubt an overlap between reflux and dyspepsia, and many patients have both. And a lot of the treatments are really quite similar, although they're not the same. So it is good to try and work out which one's predominant for an individual patient. And finally, indigestion's a non-medical term, just describing sort of general upper gut symptoms and general discomfort. So that's probably a non-medical term that we wouldn't tend to use, but reflux and dyspepsia are used a lot.
That's really helpful, Emma. So can I just clarify, just behind the breastbone or the sternum is where you feel the heartburn discomfort, and a bit lower than that is where you feel the discomfort caused by dyspepsia. Is that correct?
Yes.
So what is silent reflux?
So this is something where people might not necessarily present to a gastroenterologist because they might not realise that they have a gut problem. But essentially, silent reflux is where the acid fluid is flushing upwards and it's causing damage to the associated organs. So, for example, your dentist might say that you've got acid damage to the back of your teeth. Or otherwise you might present to the ear, nose and throat department, the ENT team, with damage to your voice box because you've got a hoarse voice, or the respiratory team because you've got some damage to the top of the airways. You may also get that feeling of globus that I was talking about, which is that constant feeling of a lump in the back of the throat. Patients are usually referred to ENT with that. Either the ENT team, your dentist, or the respiratory teams may look at that area and on their investigation see it's obviously that there's erosion from acid, and that would be termed silent reflux. So you're not getting it in the usual places, you're getting it in a different place, but it's still acid and it still requires some treatment to prevent ongoing tissue damage.
So some patients might find that quite concerning. They've now presented with signs of damage from this silent reflux. How common is it?
It's fairly common, and it's got its own name in ENT, which is laryngopharyngeal reflux, rather than gastroesophageal reflux, although it's exactly the same disease process. So we know that the erosions can be healed with an acid suppressant such as a proton pump inhibitor, and with longer term lifestyle changes, that should both heal the damage that's there and prevent ongoing longer term problems.
So the risk factors for gastroesophageal reflux disease include stress, overweight or central obesity. We actually know that having a raised BMI, so having a higher body mass, is an independent predictor of reflux disease. So being overweight in itself increases your risk. And actually, between 59 and 79% of those that are obese do have symptoms of reflux. Smoking is a risk factor, as is having a family history, alcohol consumption, and being pregnant. Emma, are there any particular risk factors that you would really focus on?
I think stress is a really important one here. We know that stress has an effect on some of the compounds and hormones produced by the stomach, and quite often that can reduce a chemical called prostaglandin, which normally protects the stomach from acid. Stress can make people more sensitive to the symptoms of reflux, so they may be having no more acid produced or no more acid flushing upwards than normal, but just the fact that they're stressed, they're less able to cope with it. And we all know that stress can also encourage bad food choices. So again, you're less likely to think this might cause me problems, and you're more likely to comfort eat. And I think we're all very well aware of that. Nicotine in smoking will tend to relax that valve, the lower esophageal sphincter that we've already talked about, and that tends to let acid come up. It can make the mouth dry, so there's less saliva produced, so there's less clear normal fluid flushing through the esophagus and getting rid of any acid that's present. And of course, smoking can cause a cough, which increases pressure in the abdomen and again can tend to flush acid upwards. And finally, I'd just like to make a comment about alcohol, because this is something that patients often ask me about. Do they have to never have another alcoholic drink? So we do know that some alcohol is worse than others. For example, beer is both acid and also carbonated. So what carbon does is it overinflates the stomach, and the acid will have a direct effect on the esophagus. Both red and white wine can increase acid production in the stomach and also relax the lower esophageal sphincter. We think alcohol like gin, perhaps, and tequila, they aren't acid, they don't contain sugar, and they may be better, but you'd need to be careful what you are having them with.
And why is it in pregnancy that we might see reflux?
Just the increase in abdominal pressure that we're also seeing with the central obesity. So if the pressure goes up within the abdomen, it will tend to cause a pressure effect on the stomach, which will again tend to push things upwards.
So what do we know about the nutritional risk factors?
So the nutritional risk factors, or the role that diet plays in gastroesophageal reflux symptoms, is really quite controversial. So we know that there are common foods that patients tend to report make their symptoms worse, and they include kind of your fatty or your really energy dense meals. So it might be that you've gone out for a meal, or typically at something like Christmas where you've overindulged, you do get reflux symptoms. Fizzy drinks, alcoholic drinks, and caffeinated drinks, or particularly coffee rather than tea, are quite often cited as being trigger foods, as are things like spicy food. And having a low intake of fibre is thought to increase your risk of gastroesophageal reflux disease. When they've done studies looking at kind of the average intake of fibre in this patient group, it has been shown to be lower than in the general population. And we'll go on later to talk about how actually increasing your intake of fibre can be beneficial for reflux management.
Eating late at night is really tricky. And again, leaving it 3 hours before you go to bed is important. And if you do have to eat late at night, then try tilting the head of the bed. And the research tells us that 10 or 20 centimetres is important. Now, on a practical note, don't do that by using a couple of pillows, because the danger is that everyone slips down during the night. So you may wake up with a flush of fluid in your mouth if you have got reflux, which can be quite unpleasant, and it can give you a dry and sore mouth. So try actually putting either a couple of house bricks under the head of the bed or a couple of books, so that you're sleeping with your head 10 to 20 centimetres higher than your feet. A lot of these tight fitting clothes will tend to cause the increase in abdominal pressure that we've already talked about.
The tight fitting clothes, are we talking about the trousers and the belt, the sort of lower abdomen area, and that's where those clothes, if they're fitting too tight, might cause a problem?
Certainly the middle of the abdomen, just under the rib cage, yes, that's where the stomach will sit, and that's what will tend to compress the stomach, and again, excess fluid will tend to reflux upwards.
And do women with bras fitting too tightly around the sort of upper abdomen, can that trigger it?
It doesn't tend to, because that isn't causing any pressure on the stomach, although if your esophagus is feeling miserable and burning, you might find some compression uncomfortable, but it won't be making the process worse. And there is no doubt that a full stomach is unhappy exercising.
And Emma, that's presumably because of the jostling motion and the increased movement.
Yes.
We want to avoid irregular eating patterns. So eat regularly, little and often is what's going to be most effective in helping to manage reflux symptoms.
Liv, that's an excellent point. And we also discourage people from bending over when they've got a full stomach. Now we're going to look at the first line treatments for reflux, the ones that do not involve medication. The first area we're going to focus on is overweight and obesity. Liv, could you take us through how being overweight can affect your reflux?
Yeah, so as Emma and I've said previously, being overweight, or particularly having a lot of additional fat around your abdomen, increases pressure on your stomach and that sphincter, or that valve that separates the stomach from the esophagus, and increases the likelihood of stomach contents moving upwards. You might find that if you have recently gained weight, that symptoms like reflux might have got worse. So anyone that identifies themselves as overweight or feels that their symptoms have got worse as their weight has increased could try losing weight. Studies that have looked into the relationship between weight loss and symptom relief has shown that losing somewhere between 5 to 10% of your body weight may help to improve reflux symptoms. Or alternatively, if you prefer to monitor your progress by measuring your waist circumference, you should aim for a 5 to 10 centimetre reduction if you're female, or a greater than 10 centimetre reduction in your waist circumference if you're male.
I often find that patients are referred to me as a gastroenterologist with a worsening of their reflux symptoms, and on asking them, they may have recently gained half a stone or a stone in weight. And we often find that it can be as little as half a stone that does make a difference. So again, losing weight is a pretty safe way of trying to improve your symptoms and trying to reduce your reflux.
About 80% of patients, losing weight does lead to an improvement in symptoms, but there are patients that find that losing weight doesn't lead to any improvement, or some actually found that losing weight made their symptoms worse. But for the vast majority, it did improve symptoms. So it really is worth trying. If you feel that losing weight may help to reduce your reflux symptoms, then you may find the NHS website helpful. It gives you free access to a 12-week diet and exercise plan that is designed to help you lose weight safely and keep the weight off. The link to this website is available in our further information and handout section at the end of this webinar. Calorie-dense meals. Up until recently, it was believed that fat triggered reflux episodes. Research has now shown us that it's the overall number of calories consumed in one sitting, regardless of whether those calories are from carbohydrate, protein, or fat, that triggers reflux episodes. And therefore, reducing your calorie intake at meal times, or aiming to distribute your calories more evenly throughout the day, so by eating little and often rather than having a large meal, will be more effective in managing reflux episodes. Patients quite often cite that certain types of drinks make their symptoms worse. Fizzy drinks, whether they're your caffeinated fizzy drink, your decaffeinated fizzy drink, or even your fizzy water, have quite consistently been shown to trigger reflux symptoms. Citrus drinks are quite often cited again as being triggers for reflux symptoms, and it's thought to be because these types of drinks are very acidic. And actually there's quite a few interesting papers out there which have shown that even when you reduce the acidity of fruit juices, they still cause reflux symptoms. So that would suggest that there's actually something else about these types of drinks that is responsible for making symptoms worse, as opposed to the fact that they're acidic. Alcoholic drinks, we've spoken a little bit before about how these can reduce lower esophageal sphincter pressure. So they give rise to more opportunities for stomach acid coming up from the stomach into the esophagus.
Beer can also increase acid production. We know red and white wine can increase acid production. So we know that alcoholic drinks can have a direct effect from that point of view, as many of them are acids. So we'll have a direct effect on the esophagus. Coffee, particularly darker roast coffees, if you tend to have fresh coffee, are more acid than milder roasts. And we know that cold brew coffee may be better. But again, we're also concerned it may be something in coffee other than just caffeine that's actually having an effect.
Yeah, I think that's a valid point to make, Emma. When you kind of look into it, they found that even decaffeinated coffee causes problems, but tea or decaffeinated tea doesn't have the same effect. So there's very much something else in the coffee that is responsible.
If you want to have tea, green tea may be a better substitute than black tea.
Patients quite often say that spicy foods are problematic for them, and 88% of people find that spice is a trigger for reflux episodes, quite often with foods like curry. So it's really hard to pinpoint exactly what is about those types of meals that is causing symptoms. Is it the spice? Is it the fact that they could be energy dense?
or in other words, high in calories?
Or is it the fact that they contain other common ingredients such as onion and garlic? What we do know is that using capsaicin, which is the spice found in red hot chili peppers that kind of gives you that burning sensation, when they've injected that or kind of exposed patients to it, that 90% of patients get reflux symptoms in response to that. So it would suggest that actually spice is a trigger and it does increase acid exposure.
Liv, you've previously mentioned that fibre may be important with reflux. Could you give us some more information on this?
It's hard to distinguish between whether it's the actual fibre, the increase in fibre that's responsible for the improvement in symptoms, or the fact that you've just reduced your intake of those other trigger foods. When you kind of look into it, a lot of those with gastroesophageal reflux disease do have intakes of fibre that are below the national average. And there was a study in 2018 where they found that actually by increasing fibre intake, which they did with fibre sachets rather than increasing food intake, led to a 60% improvement in symptoms. And I think that does suggest that actually fibre in itself does offer a benefit, because they've simply added fibre in with sachets as opposed to using foods which might have displaced other things from the diet. Yeah, so 30 grams of fibre can be difficult to achieve. And we know that actually only 60% of the population currently achieve that. So if you're aiming to get up to your 30 grams, an example of what you could be having is a medium bowl of porridge with a banana and apple at breakfast time, 2 wholemeal slices of bread with 200 grams of baked beans at lunchtime, and then in the evening, a jacket potato with a vegetable curry with some lentils in there in the evening. It can be difficult to achieve. And actually in our handout section at the end, we've included a link to the British Dietetics Association fibre fact sheet, which outlines other ways in which you can get to your 30 grams a day. Alternatively, if you think it might be quite hard to do with food, you could look at using something like linseeds or flax seeds, which are commonly found in supermarkets now. And they'll give you about 7 to 8 grams of fibre per 2 tablespoon serving.
We've covered most areas of diet relevant to reflux. However, we often get asked in clinic about other dietary approaches, and I'll just take you through those now.
Food allergy. Now, it's quite commonly believed that reflux symptoms may be the result of food allergy. This is rarely the case in adults, although it is still possible.
As an allergy specialist dietitian myself, I can absolutely agree with Liv that food allergy and reflux are very rarely connected in the general population. I do occasionally see patients where it's relevant, but even in those patients, food allergy testing would not be helpful. So if there's one message I'd like to get across to patients is please don't waste your money getting allergy testing. If you're under the guidance of an allergy specialist consultant, then that may be different, but generally it's a complete waste of money.
Now, Marianne, I'm not sure about you, but I quite often find that in clinic, many of our patients have removed dairy or gluten, wheat, or maybe another food group completely from their diet because they suspect that food group to be a problem. It's important to stress that there is no evidence to advocate that we do this to help manage symptoms. However, if you decide to remove a food group from your diet, please only do this for a maximum of 2 weeks before trialing a reintroduction. If you find that there's no improvement in your symptoms as a result of eliminating that food group, then it means that that food is not responsible for your reflux symptoms, and therefore we should introduce it back into the diet to prevent nutritional deficiency.
Liv, I think that's an extremely important point to make, because I often see patients who've taken out foods from their diet to help their symptoms, and even though it hasn't helped their symptoms, they've kept that food out of their diet, and so they end up with an incredibly restricted diet. And I think it's really important, if it hasn't helped, you must put the food back in. However, of course, if you find you take a food out and it really makes a huge difference, then it's really important to get the right advice from a specialist dietitian who can advise you on how best to keep that food out of the diet, or whether you'll be able to safely reintroduce small amounts to allow your diet to become more varied. The most important point is that you don't become nutritionally deficient by taking out foods unnecessarily from the diet.
Many of our patients suffering with reflux will also have been diagnosed with irritable bowel syndrome by their doctor. And for these patients, the following information may be helpful.
Fermentable carbohydrates, which are now commonly known as FODMAPs, is a term that refers to the part of the food which cannot be broken down or digested in the small bowel and so is fermented in the large bowel. And this fermentation process can induce symptoms of reflux in sensitive individuals. Now, studies have shown that using the low FODMAP diet, which aims to reduce our intake of these fermentable carbohydrates, leads to an improvement in symptoms of both heartburn and acid regurgitation within the first 8 weeks of the diet.
However, the jury is still out on whether the low FODMAP diet can help to manage reflux symptoms in the long term. If you think that the low FODMAP diet may be useful, please seek advice from a registered dietitian.
So first of all, what is a probiotic? So it's a live microorganism that, when administered in adequate amounts, confers a health benefit to the host. So they're best thought of as healthy bacteria that we can take in our diet, and they come in a variety of forms, in powders and in tablets. In the absence of a decent sized controlled trial, you'd have to say that you may be wasting your money with probiotics because there is no real evidence of exactly which ones work or even what dose you should take. So complementary and alternative medicines are a really big area, and I think a lot of people really want to try and help themselves. So I'm going to cover a few of them here. So there is a trial of 38 patients who were given either acupuncture or medication. The problem being that the trial is in Chinese, and as a result of that, I can't interpret it very closely. There did seem to be some benefit, but again, it would be hard to recommend because while acupuncture seemed to be beneficial, it's hard to know to what degree. But again, if people wanted to approach that, then they could. Melatonin is something which has been trialled, again, a small trial, and it seemed to work with an acid suppressing medicine called a proton pump inhibitor, and it may shorten the duration of symptoms once you've started your proton pump inhibitor, but it doesn't seem to work on its own, so again, would be hard to recommend. We're going to cover relaxation, and I think there is good evidence, as we've said, stress is a cause, that relaxation methods can help.
Stress management is definitely effective, and it's something that kind of a lot of professional guidelines that we use in practice acknowledge the role of these psychological therapies in managing symptoms of reflux. And there are quite a few studies now that have looked at how breathing exercises may be used in the management of reflux disease. One particular study looked at the effect of using breathing exercises for 30 minutes a day with some relaxing music over a 4-week period. And as a result of that, they found that at the end of that 4 weeks, there was a significant reduction in acid exposure in that group. And actually 9 months later, those that were still doing that 30 minutes of breathing exercise every day were using fewer proton pump inhibitors, or PPIs, so medication was reduced.
And what I tend to recommend to people is people often have their own things that they do, such as yoga, and that again can be very helpful. So it doesn't matter what you do as long as it works for you.
I think that's a valid point, Emma, is we often think, breathing exercises or acupuncture, but something as simple as reading a book or taking a bath or a walk outdoors, whatever for you helps to relax is what's going to be most effective. And in terms of some useful links or resources on how you at home could be using breathing exercises or relaxation therapies, please look in our further information and handout section at the end of this webinar.
And along those lines, hypnotherapy does seem to be of some benefit. The numbers aren't that favourable in gastroesophageal reflux, but there's no doubt that hypnotherapy does reduce anxiety, and it can reduce the hypersensitivity feeling in the gullet, which makes it more sensitive to normal amounts of acid. So there is some evidence that hypnotherapy can be helpful if you want to try that. For herbal medications, there's been small, poor quality trials of chamomile, ginger root, slippery elm, and marshmallow root, and there's no real benefit to any of those. So again, it's hard to recommend any of these as being of definite benefit, but if you wanted to explore them, you could. The ones where there's a bit more evidence are hypnotherapy and acupuncture, but there is no guarantee that they'll be beneficial.
We realise that complementary therapies can be extremely useful to some patients, and I suppose the take-home message would be to talk to your therapist and organise for, say, 3 to 5 sessions, and if it's not working, then stop and try a different therapy if you feel that that's more appropriate.
So in terms of smoking, we know that the reflux is more common among those that smoke in comparison to those that do not smoke. And actually the duration of smoking and the amount of cigarettes that you smoke each day does play a role in your risk of reflux disease. In terms of quitting smoking, we know that 44% of those that quit have symptom relief at 1 year, compared to only 18% of those that didn't quit smoking. It is important to note, however, that some patients find that they gain weight when they quit smoking because cigarettes can be an appetite suppressant. So weight gain is a common consequence of smoking cessation. And it's just important to be aware of that, in that it might counter some of those benefits that we typically see with smoking cessation if you're then gaining weight around the central area.
I think to just reiterate what Emma said earlier, smoking also can affect the lower esophageal sphincter and so can make you more vulnerable to suffering with reflux.
Okay, so our closing points are, just to summarise.
As we underlined at the beginning of the webinar, please seek medical advice if you have any of the following symptoms, including difficulty swallowing, unintentional weight loss, persistent vomiting, chest pain not associated with food but associated with exercise or exertion, black tarry poo, or vomiting blood.
So as we've said when we've gone through these slides, the research is really quite mixed in terms of which foods trigger reflux and which are most effective in managing reflux. So you could consider losing weight if you know that your symptoms have got worse as your weight has increased, or if you notice that you are carrying a little bit more weight around the middle or tummy area. Avoiding those energy-dense, calorie-dense meals by spreading your calorie intake more evenly throughout the day. Perhaps avoiding too many spicy foods, avoiding or reducing your intake of alcohol, and perhaps try and optimize your intake of fiber. You might also want to try reducing your intake of coffee or caffeinated drinks, fizzy drinks, and your citrus drinks. But the general advice is that you follow a healthy, balanced diet. And if you know that some of these particular things that we focused on make your symptoms worse as an individual, then you could try eliminating them. And lastly, just kind of take time for your meals, try and eat in a relaxed environment to minimize rushing around just before and after eating to really aid digestion. With regards to the lifestyle approaches that you may wish to trial to manage your reflux symptoms, the evidence is limited, but you may wish to trial probiotics. You could consider complementary therapies if they help your own individual symptoms. Try to manage your stress and consider quitting smoking. Remember that each person is individual and so may benefit from some of these suggestions more than others. We would suggest that you experiment with the different approaches that we have outlined in this webinar. Please look for our other webinars on medications for reflux and for surgical and endoscopy options in reflux. Please also see the links and handouts which accompany this webinar in the further information and handouts section.
Thank you for listening, and we do hope that you found this webinar useful. Please do look on the website for further webinars on reflux.